name is Rudy Faust. I'm a senior coordinator at the Shared Use Mobility Center, and I would like to, well, first for the visually impaired, I am male, he, him, his, brown hair and brown beard, wearing a gray shirt and some white earphones. And I would like to start by thanking our collaborators at Toyota Social Innovation for prompting this discussion. This springs from some research we're doing with them and that they would like to share with a broader audience. So thank you for joining us at the panel, What Now? Stories of Pilot Perseverance from the Front Lines of the Pandemic. Which we've described is that every aspect of transit continues to face daunting pandemic-related challenges. Innovative shared mobility pilot programs are especially hard hit during these times. Some pilots, however, were positioned to adapt themselves to meet some of the urgent needs in their communities. So here we've gathered 3 cases that we've been following in varying contexts to find out what they've learned and share some lessons that hopefully that you can take with you going forward. So joining me is Eric Lingaur who is Director of Communications and Development, the Bay Area Transportation Authority in Traverse City, Michigan, or BETA. Pamela Bynoe-Reed is Director of Communications and Development and is the Public Information Officer at the Central Midlands Regional Transit Authority, or the COMET, in the Columbia, South Carolina region. And from the Dallas Area Rapid Transit, our DART in Dallas, Texas, we have joining us both Brittney Farr, who's the Community Connections Program Manager, and Greg Ellsborg, who is their Chief Information Officer. I will just start with asking a question so they can introduce themselves greater length in what they do and their programs. But and following that, just if they could, we'd love to ask them sort of how each of their agencies have adapted or pivoted your pilot during this pandemic. So what's the biggest lesson that you took away from it, either for that service specifically or for your agency as a whole? And I will start, we'll go alphabetically by agencies, first with Eric and BETA, Pamela with COMET, and Brittney and Greg from DART.
Well, good afternoon. Eric Lingaur, coming to you from Traverse City, Michigan, on the shores of Lake Michigan. I am a visual description, 40-something male, sandy hair with a little bit of gray going on, some freckles, and a blue polo shirt today. So, our project, what we did is we launched. We took our antiquated dial-a-ride demand response service and upgraded it to a on-demand microtransit service pilot with Translo. And we launched it right smack dab during the middle of a pandemic, which is not always the wisest thing to do, to launch a brand new service when you've got reduced ridership and all types of different health and wellness guidelines that are going on within your region and across the nation. But we did it, and it's been very successful. Great efficiencies. In addition to transitioning to an on-demand service model for us, we also had a non-emergency medical transportation element that we added on to help provide free rides to see if an on-demand model could work in a rural setting to provide health and wellness trips for folks to key health and wellness locations around our region. So both of those were very successful. And so besides just kind of being crazy and launching a pilot during a pandemic, what was one of the biggest lessons that we took away, or what do we learn from this as a whole? Definitely being flexible. That's probably one of the number one things, is being flexible and being able to adjust your timelines. We were hoping, we were planning this in March 2020, getting ready for a spring 2020 launch. COVID comes around, and then you just need to be flexible to be able to move your start dates, your training, your technology, your prep, everything like that. And in the long run, we launched August 1st of 2020, and it's been really good. And I guess secondary to that is taking risks. In most cases, you would say, don't launch a new service during a pandemic, but in the long run, I think that it was very successful to take a risk and do something outside of your comfort zone, to provide a better service for not only for your community, but for your riders, and for efficiency of your staff. And so that's my answer to the first question.
Great, thank you, Eric. Pamela, we'd love to hear more about you and your programs at the Comet.
Good afternoon, and it's a pleasure to be here today. Brief description of me. I'm a sepia-toned female. I will not tell my age, but I'm over 30. How about that? I have highlighted hair, and I'm wearing a heather blue dress. I serve as the Director of Marketing and Community Affairs, as well as Public Information Officer for the Comet here in Columbia, South Carolina. And our biggest takeaway during this time period was to not think of ourselves as only a bus system, but to consider ourselves more broadly as a conduit to provide access to goods, services, and quality of life. And what this entailed was seeking out opportunities to create unlikely partnerships with community groups, nonprofits, and businesses, rideshare organizations like Uber and Lyft. And also to reimagine not only the way that service is delivered, but to also retool the narrative on what our services look like. So what the pandemic did was to shape us to be intentionally collaborative in many ways, if I could say it like that. And I concur with Eric when he talked about having to be flexible and nimble and turn on a dime. And that's something that we learned as well. And so our takeaway also starts with being immersed in the community that you serve. And early on, we connected with organizations that serve our demographic that is transit dependent, and also looked at what benefits we offer that are attractive to our choice riders. And during the pandemic, it was safety, security, and convenience. Was it safe to ride? Is it clean? What do you have in place? And we started talking about that as soon as we realized that this was more than just a cold or the flu that's being spread. So what we did was we applied to be on the city's food policy board, the Midlands Area Consortium on Homelessness, Bike and Pedestrian Committee, which is an infrastructure subcommittee of the City of Columbia. We served on the Council of the Business Districts. We reached out and partnered with our local governments. And then we said, hey, we're here. How can we help? And out of this came our mobility programs, V-Trip and PUP, which you'll probably hear a little bit about later on. Our food share initiative, the expansion of our Comet on the Go program, which addresses food deserts and last mile travel. And our partnership with Meals on Wheels that addresses food insecurity with senior adult populations, and the Don't Miss Your Shot vaccine transportation campaign. And the testing and vaccination site at our transit hub, Comet Central.
Thank you. And Brittney, I believe that's probably a good segue to some of your work at DART.
Yeah, it is. Thank you, Rudy, and thank you so much, everyone, for being here today. As a visual description, I am a white female, brunette, long hair. I will also not be giving my age, and I'm in a pink striped dress. It's a pleasure to be here with you today, along with my colleague, our Chief Innovation Officer, Greg Ellsberg. Just for a little bit of context, the DART service area city is 13 service area cities. It's approximately 700 square miles, so it's almost the size of Rhode Island, which makes serving it in and of itself complex, and then you add in a global pandemic. I'll start with our lessons learned, and it's actually a positive, and that is we learned just how quickly government can function. For those of us in the government sphere, you know, we are not known for our speed or our nimbleness. And I will say that the COVID pandemic taught us just how fast we can move if we set our minds to it. So what we did is we created a program called DART Serves. Once we came out of lockdown, like many of you, we were down on ridership, we were down on our operations, but we knew that our communities needed help. Leading into the global pandemic, we'd already started to take a look at how we can better serve our communities outside of the traditional buses and trains and mobility services. I have kind of a unique position in the transit sphere. I run our Office of Community Connections. And so I deal with a myriad of issues that don't directly relate to transit, but affect both our communities and our customers. So things like homelessness, things like human trafficking, things like food deserts, food insecurity, job access. And so what the COVID-19 pandemic did was really let us take that and run with it. And so under Greg's leadership, DART Serves was a unique program. We actually wound up developing 11 different programs where we connected with our 13 DART service area cities to see what they needed in this time. And so what we wound up doing is things like food delivery for school-age kids. For a lot of the kiddos in some of our school districts, the only meal they get is the meal they get at school. Well, if the schools are closed down, they don't have access to that food. So we reached out to the various ISDs and wound up partnering with DISD, which is Dallas Independent School District, Garland Independent School District, and our Richardson Independent School District to do meal deliveries. We would go out, we would go to the distribution centers and load our buses up with all kinds of meals, and then stand out in the 110-degree Texas summer in a mask, handing out meals to the kiddos. We also modified how we do our paratransit. Rather than have our high-risk individuals go to the grocery store and get their own groceries, we pivoted and started doing grocery delivery, where the pickup would be the grocery store. They would go on the Kroger app and order their groceries. We would send someone to pick it up and then deliver it to their door, saving them a trip and saving them from the fear and hassle of going to the grocery stores. We actually ended up delivering 188,000 meals to children. It was one of the most rewarding things that I've done in my 8 years here at DART. And so again, I can't commend the leadership enough. And I'm sure I'm leaving something out. So with that, I'll turn it over to our Chief Innovation Officer and see if he has anything he wants to add on the program, or if he has a different lesson learned.
Thank you, Brittney. And the thing that you left out to some level is your immense contribution towards that outcome. So but you're instrumental in helping us operationalize those programs. And for a visual description, my name is Gregory Ellsberg. I'm Vice President and Chief Innovation Officer at Dallas Area Rapid Transit. I probably look fresh-faced, but that's just because I shaved. So I have dark brown hair, light skin, and I'm wearing a charcoal jacket, but it kind of looks blue on the camera, at least from my screen, so who knows. So in terms of our approach during COVID-19, we began DART Serves when in March of last year, just when we started seeing the impact of the pandemic. It was actually one of the final meetings we had in the office before the office staff were moved into working remotely, that we sat with our president and chief executive officer, Gary Thomas, and we talked about, we have a monthly mobility as a service meeting to talk about how we're evolving our modes of transportation. We just pivoted in that meeting, right? Things have changed. We know that things are starting to get difficult with the community and with regards to the impact of COVID-19. And we know it was affecting our ridership. We realized it was going to cause impacts to our vendors and to our existing partnerships and to our own operating staff as well. So out from that, there were a number of initiatives that came out of DART, as I'm sure there were at many other agencies. Some were focusing on operator safety, of course, and how we manage those elements. And there were some great initiatives that came out from that. I took the mantle up and led the charge on how we connected to our communities and supported them in this time. Put together a crack task force team, including Brittney, and a cross-functional team. And then we looked at how we matched our assets and resources and capabilities with the unique role that the transit agency provides within the region to different needs that were being surfaced for our riders and for our communities. It wouldn't even have to be riders per se. You know, for instance, the ISD school delivery program would possibly affect many families that may not otherwise use DART. And the importance of that is, you know, we rely on, it's not the only reason, but we rely on taxpayer funding to operate. So we need to look at how we're serving the communities. And we were faced with a condition where our drivers, because of reduced schedule, were not driving as much. So we wanted to find programs that we could put in place that would really help them. And our core principle with DART Serves was we established initially four criteria. Whatever we did had to be operational within 30 days. And that made us agile because we had to get approvals, we had to push everything out and be ready in 30 days. We also had to make sure that all programs focused on a life-sustaining mission. So they had to really support people with, you know, things that suddenly became endangering from the pandemic. And that's food delivery, that's you know, mental health and care packages, and supporting people that were maybe getting isolated, things like that. We also had to utilize our own resources to support our constituents' needs. So if something was super tangential to what we did and we'd have to go and try and do completely different things, it didn't feel like it was necessarily the right fit. And finally, of course, we had to maintain safety for our operators, our operations, our facilities, and the public, and anything we did. So with those four guiding principles, any program that came in, the task force assembled and we got together at first 3 times a week because it was so much moving quickly. And we looked at every program that came in and we asked ourselves those questions. And if the answer was yes to everything, then we would pursue that initiative. And if it wasn't, we'd see where we could help, but it wasn't necessarily something that fit into the auspices of what the agency could do to support. So incredibly proud of the team, and the DART Serves brand is now actually becoming an evergreen brand that we're using for our social outreach programs and our corporate community support. So something that has been really good, and it's you know, for us it was also kind of a silver lining in times when a lot of the news was really painful and doom and gloom, not just in transit but in general. To be able to provide positive information back and get, you know, local stories out there and support for the community and try and drive some goodwill and some happiness throughout our communities. That's it for me. Thanks.
Oh, Eric, I'm sorry.
No, so Greg and Brittney, they kind of highlighted their process on how they determined like what community groups they were going to work with. Greg mentioned like the 4 pillars, but can you give an example of like how you, like a specific example of how you decided to work with which groups and like what an outcome was from that?
Yeah, certainly. So we're fortunate here at DART to have really great relationships with a lot of the service providers already within the region. So we relied heavily both on the work that I do with a lot of our nonprofits. So for example is Catholic Charities. I've been having conversations with Catholic Charities on topics that have nothing to do with COVID-19. We've been talking about homelessness and affordable housing, but they were a partner of ours. We'd established a really great relationship. So when the pandemic hit, I just reached out to the CEO of Catholic Charities Dallas and said, we're putting together a response to help serve our communities. What are your needs? We'll come to find out Catholic Charities supports a senior center called the Brady Senior Center, and they did meal deliveries for their seniors. And so that was one of the programs that we were able to assume under DART Serves and deliver care packages, food packages to seniors. Similar with the ISDs, we have an education outreach department. And so their relationships already established with these organizations is what it was able to let us move so fast, because we would go through the criteria that Greg outlined and we would all shake our head and say yes. And instead of having to email back and forth to get a response, someone could pick up the phone with their connection that already existed, and we could almost actually literally have a program on the ground the next day because of the relationships that we had already established with all of those organizations. And it just strengthened that relationship and continues on past, well, hopefully we're past the global pandemic.
Absolutely. And if I may add one thing as well, one of the principal things that we learned really quickly was how to match our capabilities on the organizational side back to the program. And so once we worked out for the first time, okay, we can use this booking system to manage, for instance, paratransit grocery. We can use our booking system for microtransit and paratransit to link and our call center to explain to riders how to make grocery bookings happen. Once we put those connections together, and then, I forget the name of the process, but we also do like a blast call out to all our riders on the paratransit side when we make them aware of something new. We thought, okay, we can pull these pieces together and quickly build a program around those existing capabilities. Our finding was that for longer term projects such as yours, Eric, I'm sure there was a lot of thought that went into how you deployed, but using the existing framework, if you have to move really quickly, knowing the capabilities you have as an agency and being able to leverage upon those was incredibly important for us. And that was really knowing those pathways, figuring them out, and then quickly acting on them was paramount for all those early programs. And the majority of the programs were live within 3 months from that first March date. So we really moved quickly on it in terms of it was thick and fast for a while.
Yeah. Greg and Brittney, I'm really impressed with how you address food insecurity, especially leveraging your relationships with grocery stores. It's almost like you became a bigger, better, and greater DoorDash in a sense. I just think that's very impressive. I know, like you all, we partnered with Senior Resources and began to deliver food through Meals on Wheels to seniors in our two very large county service area. And it still goes on. One of the things that we found was, like everybody else, when the pandemic hit, we had to reduce service, and then we had drivers that were at home, and we were able to bring a lot of our workforce back to work delivering meals, and it just gave them such a sense of pride that they could be inserted in that particular way, and the smiles on the people's faces. And that backlog with Meals on Wheels still occurs, and we're still delivering meals even now, as we're trying to come out of the pandemic, if you will. But it's work that endures.
Pamela, that's a really good point. All of us as transit agencies, we provide an essential service for our communities as far as transportation goes, always and throughout the pandemic. But the point about, having our staff go above and beyond and connect in the communities to provide those additional services and just have additional value that they provide is a really, it just gives you goosebumps, to have that kind of experience above and beyond just the normal day-to-day activities that we provide our communities.
Yeah.
And that's really great to hear, because that's something that I was curious of, because our workforce, there were people we had to turn away, like, no, we have enough volunteers, please, we have to social distance. And so, that was a question that I was going to ask the two of you, is how your staff felt about it. Because to Greg's point, it was doom and gloom all the time. And for me, I was out there twice a week, every week doing grocery delivery. And I think from a mental health perspective, it got me through the most difficult time of the pandemic. And I'm just wondering what the feedback is from the staff that help support your initiatives. Is that something that they've come back and said, yes, this was so good, because we are public servants. So
yeah. Definitely. And that's something that we definitely saw, as far as, I'm glad to be back at work. I'm glad to see my coworkers. I'm glad, that we're able to do the service to help other people. Some of the people that they saw were people who rode their routes, So that was an extra added bonus, a little bit bittersweet, but at the end of the day, it was a good feeling that you were able to satisfy a need. And speaking of needs, one of the other things that, that we found, like Eric and like Brittney, you and Greg, was that it seems like not the opportune time to start a new service in the middle of a pandemic, but sometimes that's the best time to do that. And we were able to really look at our system and where we were delivering service and come up with a program for mobility for seniors and those who are disabled, and their V-Trip and PUP. And so what we did was, through grant dollars, we were able to institute a service that if you have a friend or a neighbor that has a car and you live outside of our service area, but still within our boundaries, we will reimburse them gas money up to $50 to $100 a month to bring you to where you need to go. You just have to register for the program. Our PUP program is kind of similar, but instead of using a friend or a neighbor, you use taxi services or rideshare, Uber and Lyft, and you get a PEX card or a little, like a credit card. And, it's good. It's reloaded at $50 every month. The money doesn't roll over, but you get that $50 a month for transportation. So it's thinking outside of the box. I think that's what it made us do. And not just look at using our large 45-foot buses to provide transportation, but how can we move people reliably, safely, and, in an out of the box kind of way.
Interesting. And so Pamela and Eric, for my benefit, with all of the changes that you made and your ability to be nimble and to change things up, what do you think will stick around after the global pandemic? Are there things that your agencies are starting to rethink from a permanent operation standpoint? Like, wow, this worked so well. I mean, the two programs that you just talked about, Pamela, seem like they have a really good response. So Eric, is there something that you guys are thinking that you just started as a pilot or just a response to COVID that you're now going to continue on in your day-to-day operations?
Definitely. So we might be behind a little bit in the game, but so, we were doing traditional demand response dial-a-ride, and the on-demand microtransit model in a rural setting has been fantastic. It has been so more efficient. We're doing more with less. Just one little nugget that I like to share is our dial-a-ride service had almost a 30% no-show rate. So a third of our rides were going unused. We'd send a vehicle out, no one would be there, or they'd cancel within the last minute and we wouldn't be able to get to, reuse that time slot. Using a microtransit on-demand real-time model has reduced that no-show rate down to about 3%. So we're maximizing and utilizing all of our service. So that means more rides for more people, and that's just something fantastic. So definitely the on-demand model is going to stick around for us. The pilot is going to continue, and we're even looking at, right now it serves about a 20 square mile in and around Traverse City. We're looking at expanding it to our whole service area just because of how efficient and effective it is.
Yeah, I'm not really sure on our end, because as things start to open back up and as we start to resume normal operations, maybe Greg can share some executive insight on this, but I'll be curious to see from a capability standpoint, right, what we can continue to do. I know in my work, I'm going to continue to serve those organizations, serve those communities in the best way that I can from a community connection standpoint. But I mean, from things like the grocery delivery, I mean, that not only saves us a trip, really, because you're not having to take someone from their house to the grocery store and then pick them back up at the grocery store and back to the house. So not only does it save us money, because we all know that paratransit is not cheap, but from like a liability perspective. So I think as we start to emerge into the new normal, it'll be interesting to see what paradigm shifts we make as transit operators. Greg, do you have any executive insight you can share?
Well, I absolutely agree. The paratransit grocery delivery is a great example for that very reason, that it saves us a trip, right? So from the cost perspective, it costs us half as much to operate. And if it's a preference of the rider versus something that we're putting upon them, then absolutely, if they choose for it, then it's a wonderful thing to be able to offer. More recently, we've also, I mean, we're still running that program, but we've also run paratransit on demand pilot recently, and that's been really successful. And it's very interesting to see the shift in ridership patterns in terms of people having on-demand service for paratransit versus having to schedule a day in advance. And when we survey and interview and talk to our riders, a lot of riders are really excited about the increased mobility that provides. One area that I've been thinking around a bit recently that's a little maybe off topic from the core of the conversation, but I think is relevant, is DART has a fare capping policy. So what we do is, if you ride for, I think, 16 days a month, you get the rest of the month for free. That's if you use our mobile app, GoPass, or our tap card to pay. So we have a record of your pay. We have an account-based system with that record. But thinking around ridership pattern changes, especially on the commuter side, that may become a model that's not as effective anymore for many riders, because more people may be coming on a hybrid work schedule, or maybe traveling on different travel patterns to what we saw pre-pandemic for many riders. So one area that we're exploring is potentially a incremental rewards-based approach in terms of how we can incentivize people to ride, but also then reward positive mobility behaviors, things that when you ride transit, you have a better environmental impact. You're reducing traffic on the roads, you're doing a better good for society in our region. So how can we reward that behavior, but do it incrementally so everyone riding can get that benefit, and we can encourage people to ride the service, whether you use it twice a month or 20 times a month. So it'll be very interesting seeing how, as ridership does continue to recover, the ridership patterns that we can observe through those account-based systems, whether they shift or not. If they shift, maybe we look towards a new model around incentivizing ridership. If they don't, maybe we stay with fare capping, but it's something we're absolutely looking at from our side.
Good.
And so if I can ask Pamela, on your programs, I'm really interested around what you're doing on the vaccine side, because we have a few programs we've been working on, and there'd be microtransit and on-demand vaccination hubs, and doing free trips through our paratransit service and also microtransit services. But I know you've been doing some stuff on your side, so would you like to share?
Yes, we have. Thank you, Greg. So we launched our Don't Miss Your Shot campaign in February, and really pulled everything together, from the microsite to the collateral to the concept of Don't Miss Your Shot, in about 2.5 weeks. So speaking of having to be nimble and flexible and really quick on your feet, that was one of the big things that we did earlier this year. And so starting that out, we knew that we were able to provide free transportation through our fixed route. And we also knew that we can utilize paratransit for those who are 65 and above and or disabled. And, we kind of relaxed the stipulations on, you have to be enrolled in our paratransit service. They didn't have to do that. Just show that you're 65 or above, or have a doctor's note that, you're disabled. And, they were able to ride to get to their vaccine appointments. But we went a little bit above and beyond that. When we developed the microsite for the web, we partnered with the area hospitals. We pulled in like the VA, we pulled in pharmacies, we pulled in any and everybody, clinics, any and everybody who would have access to the vaccine and anticipated being able to deliver it. We actually featured them on our website, and we called this microsite cometcovidhelp.org. Figured that would be easier than don'tmissyourshot.org. That's kind of long, so we kind of figured, okay, we're here to help. Comet COVID Help. Go there. And we put up a bunch of billboards all around the city, and people went to the site. We partnered with DHEC, the Department of Health and Environmental Control, so that people not only knew, is it my turn? Because that was kind of big in the beginning. Is it my turn to get the shot? How do I know when it's my turn? So there was a link to DHEC to find out if it was your turn. And then it was also another link to let you know the locations. this is where you can get your vaccine. And then we listed what fixed routes were available. We also put the information for paratransit if you qualified for that resource. And then we leveraged our 2 new mobility programs, V-Trip and PUP. Let's say the Comet doesn't come to where you live. Guess what? You can call us and register very quickly for V-Trip and PUP, and you can take either a ride share or a taxi to get where you're needing to go. And that's free as well.
That's great. That's a comprehensive set. I mean, I think that's even more types of things than we did at DART. But one thing that we did that was fun was kind of different was we actually at one of the mega centers we actually had a vaccination bus, and so we had a DART bus that was going around and would pick people up at that park in Dallas, and then when you got on, you could get your vaccination while you're on the bus. They would sort of take you around and you skip the queue basically to get vaccinated. And that was, we also then, when people got on the bus, gave them a free 2-day pass. So they got, the ability to the equivalent of the ride for free there, in fact.
That was nice.
Yeah.
It was like a mobile, you almost had a mobile clinic going.
Almost, yes. We had the nurses on the bus administering, and
nice.
And they're an so it worked pretty well.
That is nice. That's really thinking outside of the box. We weren't quite that creative. We actually partnered with a healthcare organization as well as DHEC to do testing and provide vaccines at our transit hub. So you still kind of have to come to us in a way, but at least, we can kind of catch those people who maybe just passing by, or it's more convenient because they have a bus that they're going to catch or something like that.
And that's a perfect example of a program, right? So we had a request early on to say, can we use the DART Transit Hub as a testing site? And the answer was no, we really can't, because it risks our other riders, because you're bringing then people that potentially have COVID into a space that people are using for transportation. So it didn't pass our 4 criteria, but vaccination is a completely different matter because it's, but yeah, so it did. There's an interesting parallel between the 2 shifts in the timing in terms of how we run programs. That's
yeah. It's interesting. One of the things that we all struggle with as transit agencies is homelessness. And so, we have the homeless population that would come and get their vaccines, because it was readily available and they didn't know where else to go. But it also, another opportunity that came about for us was really, really being intentional about partnering with those social services agencies to try to address the problem of homelessness and public transportation. We're not, and I'm not trying to be facetious in saying this, but we're not a mobile home, so you can't just camp out at the bus stops or camp out, on the buses, but if you're in need of certain services, maybe you're in need of mental health services, just trying to expand our reach in a sense on something that affects us, but also affects other people while still providing a service.
As far as both that and the vaccines are concerned, we had a question regarding, specifically about vaccines and food and just some of the, temperature control requirements and all that. And, perhaps this might apply to social services as far as, capacity for interventions, et cetera, that might not exist at the transit agency. How did you handle that in your partnerships? Was that something that was mainly outsourced, or? Yeah.
So are you asking about, I'm trying to understand the question. You asked a little bit about the temperature of the food. But
food and vaccines, I guess, if where there was, yeah.
Oh, okay.
Well, perhaps more for DART.
Okay, because that was a little tough one for me.
The short answer is really big ice chests on the buses, but not for vaccines, but for food delivery. We haven't attempted to directly deliver any vaccines. That's all handled by healthcare professionals. But in terms of operating a service in which they're in an air-conditioned space, that may be on a bus, so they can operate in that. For food delivery, there were actually some logistical questions. We looked at our box short buses to see, can we take some seats out, and what's the space requirements, and how large are the containers to have the meal deliveries in, and things like that. So there were some operational logistical pieces, and we had representative from our bus operations as well as our engineering department in to say, okay, we need to reconfigure a bus. How do we do that so that we've got the right space requirements to accommodate package size? One additional thing that we had to consider that never really became an issue per se, but it was something we always had to be aware of, was it would fall outside of our union regulations if we were to ask a bus driver to lift the packages and take these big heavy boxes off. The reality that we found, so what we did is we said, okay, we need effectively a chaperone. If we're taking this from place to place, someone from this organization needs to be there to take the thing on and put the thing on the bus, take the thing off the bus. The reality is that as soon as someone shows up and realizes the cause that they're working on, they're more than willing to help. So everyone ends up pitching into helping regardless, is what we really found. But we can never ask our bus drivers to actually do that lifting because it's not part of their specification and because of union requirements there too. But on the food side, really big ice chests and knowing the logistics of getting stuff on and off the buses was the main consideration for us.
Great, and we'll start with Eric, maybe because this is coming from Michigan. Have you had any trouble hiring and maintaining enough drivers? Our Detroit area agencies had and are still having huge trouble hiring to the extent that they're running 65% pullout with fixed route buses. Tips for hiring despite the pandemic, from Megan Owen.
Oh man, so I think every transit agency, well, I think every business, maybe in the country, especially in Michigan, is looking for staff across the board, especially in a place like Traverse City, which has a strong seasonal workforce because of the summertime and things like that. So as far as so the answer is yes, we are short staffed. We're probably at about 80 or 85% of our service delivery because of not having enough resources to run full service and ridership still being a little bit low. And we have used every tool in the toolbox to recruit and get the word out. We're for the first time, we're going to have television ads running during the Olympics. For hiring folks starting this next week. We've got digital display and AdWord campaigns through Google, social media outreach. We are doing radio advertising, print advertising, basically every tool in the toolbox that we can use. The hardest part for us, and larger areas like Detroit and Dallas have a little bit more of an employment pool. Northern Michigan only has so much resources available, and it's very expensive to live here. So we can't market to folks in, well, we'd steal folks from Metro Detroit, but from Detroit, Grand Rapids, Lansing, Chicago, some of the bigger areas to come and work in Northern Michigan because they can't afford to live here. So that's one of our other challenges, is that an entry-level position like a driver or a dispatcher, things like that, they need to live within an hour of our area to be considered for employee, because they wouldn't be able to afford to live in this region, which is unfortunate. Right. That's a whole nother affordable housing discussion that we should get into.
Yeah. We did touch on some of that, and then Pamela, just closing in this last minute, just some of your, I'd love for you to highlight just some of your efforts with drivers and and additional employment outreach.
Yeah, so what we've done was do sign-in bonuses and different things like that. That's been helpful for us. And of course, we didn't advertise as aggressively as Eric did, but we put a lot out. Our people are so engaged in our social media. I mean, that's where we get the biggest bang for our buck, is through our social media channels. And that's where word of mouth spreads like wildfire. And we got a great amount of people that came in there. Our prime contractor, RITP Dev, has been very aggressive in outreach as far as connecting with our South Carolina Department of Employment workforce to recruit people. And we've been pretty successful. Our labor pool is pretty much up by, I want to say about 25% of what it was before. So they've done a good job.
Well, thank you so much. And Eric, Brittney, Pamela, Greg, thank you so much for joining us and sharing your experience with your pilots. I hope this provokes further discussion at our summit and further thoughts. I hope you'll check into some of the resources that we've posted regarding their programs.